I'm really curious about your take on what this all means and what this all says about our healthcare system. When there was a Wegovy shortage, there still is, but when you wrote something about it in the middle of June, and I'm going to read that to you and I want your response. You wrote this: obesity is the most common chronic condition in the US, and patients deserve so much more than the healthcare system has delivered. So do you think currently, as we sit here today, the healthcare system in the US is broken?
Yes. I don't think it is a novel statement for me to say that it's broken, but I sort of grew up on the philosophy of the best way to complain is to build something better. So it's really easy to critique. It's really easy to sort of sit here and say, here's all the ways that the healthcare system is broken. But I think that the best way is to try and build something better. And so that's what we're trying to do. That's what rowers wake up every single day dedicated to do. And in terms of what I think this particular treatment or this wave of new treatments can do, is it can really hold up a mirror to our healthcare system and highlight the distorted incentives. Because so many people want this and so many people need it, I think it will shine a light on the most distorted areas of our healthcare system, where you will see employers, you'll see the quotes that are given from benefit managers or employers. They'll start to focus primarily on cost. Where I think if you just take a step back, and if the costs weren't an issue, and again, it is an issue and it's a real issue, but just ignoring it for a second, if we just looked at the results of the medication, we would be asking ourselves, how do we get this to everyone who needs it? But given the cost, you see the initial reaction and the initial conversation be, it's too expensive, we're not going to cover it, or how do we prevent people from getting access to it? And I think that does highlight some of the challenges in the healthcare system. One, the role that employers play, the role that insurance companies play in terms of playing gatekeepers to these new innovative treatments. And I think you see, that system set up tremendously inflated cost of these medications. It is not by accident that these medications are $1,500 in the US and $150 in other countries. And even when you see $1,000 or a $1,500 price, no one is paying that $1,500 except for the patient. When an insurance company is not paying it, pharma company is not receiving $1,500, no one is paying that list price except for the person's insurance. It's like painfully ironic, but the only person paying that $1,500 is the patient. And so I do think that this entire class of drugs and the level of efficacy they have paired with the significance of the pain point for patients will create this confluence of events that shines a light on all of the problems of the healthcare system and create this, sweeping momentum from patients and from builders like us and other healthcare providers in the ecosystem. And I think the next 2 to 3, 5, 10 years will be incredibly exciting. And I don't think it is an overstatement to say that both the treatments that are available now and the ones that are on the horizon and our understanding of the mechanism underneath them will lead to the potential for us as a society to truly eliminate obesity. And I think it's on all of us to see how fast we can do that.
So what you're saying is you believe in 5 years, the entire United States healthcare system, you believe, could be overhauled?
I don't know if we could do it in 5 years, but I do think that I love the famous quote. I think people overestimate what they can do in 1 year and underestimate what they can do in 10. I don't think our healthcare system is going to be overhauled by those on the outside or those on the inside. I actually think it's going to be us finding ways to work together, both the established healthcare system and new entrants, sort of the incumbents and insurgents working together in that way. And I think that the fastest way to overhaul or improve the healthcare system is to put as much power and control over the flow of money in the hands of patients. The more that patients get to determine what good healthcare looks like, the more they get to vote with their feet, the more they get to control the dollars and who earns it, the more that the healthcare system has to compete over who can best serve patients. And it'll mimic other consumer and individual driven industries that more mimic competitive, rational market dynamics. And I think that's what we're seeing. That's what we've seen in the cash pay universe of healthcare. But the cash pay universe is not all encompassing. And I think that we need to bring that same level of competition into the established and insurance-based healthcare system. That's really what the core of Row is this idea of empowering the patient, working backwards from the goals that they have, and delivering the most effective and most convenient solutions, whether that be us taking on the complexity of a cash pay experience or an insurance-based experience. But while it's maybe not 5 years, I do think it is absolutely possible and therefore worth trying.
Reitano, thank you so much for your insights. You're welcome back anytime.
Thank you so much.